I just want to welcome everyone. So, wow. Apparently this was a topic that people wanted to talk about. We're excited to have everyone join us. My name is Jenny Gates Beckman, and I'm the Director of Community Engagement and Education at the Jewish Federation of Omaha. This evening is part of a series of lectures that we'll be hosting over the next few weeks. This first one is we're hearing from local clergy and community members as they discuss the moral and ethical implications of the COVID-19 pandemic from the perspective of Jewish values. Our moderator tonight is Marty Shukert, and our panelists are Rabbi Steven Abraham, Rabbi Ari Dembitzer, Rabbi Mendel Katzman, Rabbi Brian Stoller, and Dr. Speedy Zweiback. I do have to thank the support of the following groups: the Klutznick Chair in Jewish Civilization at Creighton University, the Dr. Bernard H. Bloom and Dr. Bruce S. Bloom Memorial Endowment, and the Schwalb Center for Israel and Judaic, or I always say Judaic, but it's Jewish Studies at UNO, and the Jewish Federation of Omaha. We're super excited to have you on here. We are going to shoot for wrapping things up at 8. We are also going to engage in some questions. We are preferring that folks put their questions in the chat. And Marty, did I have anything else? I'll do some wrap up at the very end, but I'd love to hand it over to your experienced self to move onward.
Thanks, Jenny. Well, welcome to Jeopardy. And boy, if that isn't a well-named thing for what we're in. And our topics for tonight, by the way, for the panelists are pandemics of the past, great abbreviations, spike proteins, bad public policy, and probably most importantly, impossible choices. So we'll start out with the first question that I have. Now we'll get serious if we weren't before. And the question really deals with that last category. The coronavirus pandemic raises many difficult ethical concerns that we as Jews and the panelists as rabbis and physicians have to grapple with. To me, one of the most wrenching of these issues is related to triage and treatment priorities. And I'd like to pose a not so hypothetical to the panel. In a pandemic surge, a hospital is short on a valuable treatment resource. Could be ICU beds, could be a drug like remdesivir, or some more effective future pharmaceutical. You have 3 immediate emergency demands, and only 2 of these resources are available to serve. Based on Jewish values, how do you choose who's treated? Who would like to start that one out?
I guess I want to clarify the question a little bit.
Yeah.
What do you mean by who? Like what we're choosing between people?
3. You've got two doses of something or 2 resources, and there are 3 people who are demanding those immediately. If you're a rabbi, how do you advise a physician who's asking what happens if I'm in that situation, which has been happening? Or if you're a physician, how do you possibly choose?
That's a very actually halachic complex question. That was really cool that you asked that question. There's a lot of responsa about that. There's actually a lot of literature about how you prioritize in a case like this to not get so complicated. There is an assumption that you have to trust the medical care and to say who is the biggest chances of actually surviving something like this. And that is the simple answer. Although there's a 4-hour answer, which I think you don't want. Meaning there's a lot of different criteria that go into this. Rabbi Feinstein has a long criteria when it comes to what's called a chazaka. In other words, there is something that's called first come, first serve. There is an idea like that, but without getting too complicated, which I could give a 4-hour talk on this, The simple is we trust the medical care to say who is the most likely to be able to actually live with this medication. That's the simple answer.
Other? Speedy, I think you're muted. You're talking, but are.
Can you hear me now?
Yes.
Certainly the ones that will, there may be more than one person who would survive equally. And then it's a dealer's choice. One would say, let's take the young because they will survive the longest and benefit the most. Someone else would take, let's take the wisest. Or one could say, let's take the wealthiest. Hopefully that's not what one would say, but that would be a consideration. I myself in that situation would probably try and help the younger people first, assuming that their risk was the same.
Mm-hmm. Other thoughts?
Well, I'll jump in, Marty. I'm not familiar with the response that Rabbi Ari is referring to, and I have no reason to think, that I know more than he does on it. My feeling, in terms of making judgments about who is more likely, and I think that's a judgment that certainly a physician is in a better position to make than a rabbi is. But I think of a passage in the Talmud that just kind of raises the question about who's to say that one human being's blood is redder than another's. So I'm uncomfortable with conversation about kind of making assessments about who is more deserving, and although we might use the language of, well, this person is much more likely to survive, maybe that's so, but that's also an assessment of who's worthy or who's deserving of it. And I just have kind of moral hang-ups about that. So, recognizing of course that doctors have to make those kinds of decisions all the time in allocating scarce medical resources, but to my mind it also it's a very difficult ethical question because it is a little bit of playing God.
Totally.
So let me ask a follow-up, and this will be really directed towards Steven and Mendel, so because we're letting them out of the last one, but this is related, so it's going to. So a related question is probably going to emerge with luck in the foreseeable future, that there is a safe and reasonably effective vaccine developed. In the early going, and perhaps for a long time, there aren't going to be enough doses of this vaccine to go around. According to our values, how should we set priorities? Or is it simply on a first come, first served basis, which will inevitably benefit people who have more access to medical care?
I think it's a complicated situation, and we're probably going to need, depending whether it's 1 or 2 doses, anywhere between 2 and 400 million doses of the vaccine. Now, since we don't have a vaccine right now, it's moot. But once we get it, it's one thing to say we have an effective vaccine. It's quite another thing to say we now have 200 or 400 million doses, and to whom do we send the doses? I think it's very, very complicated. And I think it's very, very unknown. And I look forward to having that problem, but I don't know how to solve it.
Please, Rabbi Katzman.
I was formulating the earlier question, but I guess you're making it more.
You could do that one too. It's fine.
No, it's okay because it's really a lot more complicated, and I think in this case the question is probably more important than the answer, even though we're looking for the answer. But the need to really think about the other person is I think the new normal that we're facing now, that we have to start thinking not only about me and my immediate circle, but we really have to start thinking about the entire world. It's a phenomenal situation that's never faced us before. But I guess the short answer, because obviously there are a lot of barometers here, the short answer would be a balanced conversation between physicians, scientists, and Torah scholars would really have to really comb through the intricacies, because yes, there is a lot going on. For example, everybody's familiar with this, with the example that the Talmud talks about: an individual who's found in the desert, has only 1 cup of water, just so he doesn't have the obligation to provide the other person, even though we know that the other person is going to die. Whereas if he has enough for himself, but he's just storing for in case he might need it tomorrow, which is probably not, and the other person is going to die for sure, then you have the obligation to reach out. So I think we're really coming across that now more than ever, that each and every one of us really has to look around. By putting on our masks when we're not concerned necessarily about ourselves because we have the antibodies, still we're concerned about the others. This is also going to become a bigger issue, and to really decide who gets the vaccine. If one comes up with a one-liner, I'd be very concerned.
I don't think adding. I'm not a big fan of adding to discussions when everything I think relevant has been said. I think that the text from Bava Metzia that Rabbi Katzman brought up is very much apropos about the story of the 2 individuals who were in the desert with 1 glass of water. I would say, though, that there is a question of when the vaccine comes, who were those people who were on the front lines? I think that would be my personal preference, would be the people who are most, if you're able to stay indoors and you're able to be safe, okay, let's put you in some ways in order of second, and make sure the people who are on the front lines, who have to be out and about with other people, and have no choice, whether it's for the economy or for schools or for healthcare workers and first responders. Let's make sure that they're taken care of, because they've been taking care of us. And I think the Rabbi Katzman's answer is, I think, brilliant, which is that if anybody can give you a one-line answer, they're probably full of it. But I would simply look for the people who are mostly doing as much good at the moment as they can be. Let's make sure that they're safe. And even at the moment, to my knowledge, and Dr. Zweiback may know better than I, but my understanding is that even with all of the antibody tests, they're all a bit of nonsense. That nobody is 100% sure that even if you've had COVID and you've had the test and you were positive and you came back with the antibodies as being positive, that still is not a guarantee that you can't get it again. And so, I think we have to be very careful. I have a friend of mine who's got a synagogue in New Jersey that was kind of in the epicenter of when this was going on. And he joked that people would get, they'd come to Shul on Rosh Hashanah with like a card that would say, I've got the antibodies, like I passed the test. And it's like, I don't think that's good enough, right? That's not telling me anything. Like, all that's telling me is that you had it. So I worry about that as well. But I think the first responders and the people who are most at risk in their own lives and taking care of others, they should be dealing with first. And then we start working our way down.
Down the chain,
Yeah. Again, please, if you're not a panelist, make sure that you're muted. That's important, because otherwise we pick up background noise. Another interesting issue that's being raised with vaccines is that because of the unprecedented speed that these are moving toward, there seems to be an unprecedented amount of distrust and a fear that it's being developed without adequate testing, that there are certain people who are opposed to vaccinations anyway. How do you deal with that point of view? There is more uncertainty in the society than maybe there ever was. Any thoughts about that?
All right, I had to end the last one, so I'll start.
Yeah.
Listen, I think it's very unfortunate, and I mean, speaking, only from the domain that I really can and trying to stay in my lane. I think it is very unfortunate that this has become very politicized. And so, there are people who make the decision to not vaccinate, whether it be their children or for any other reasons, although Judaism really does speak to the idea of vaccination, and at least for the conservative movement and papers that have been written, even for the Solomon Schechter day schools, this is 20 years ago, whether or not it would be acceptable for someone to decide to not have their child vaccinated and what would happen. So, my personal opinion would be is that that would be something that would be mandatory. I once asked, just for whatever it's worth, of the Fresnel Jewish Academy, just as the Jewish day school, that has the ability for religious grounds to not be vaccinated. So I asked the question of the school saying, has there ever been anyone? And they jokingly said no, because it would require one of the rabbis to sign a paper saying that would be acceptable. And so not one family has ever used that route at the Fresnel Jewish Academy to ever not be vaccinated under religious grounds. So, for me personally, I think it's a selfishness issue. When the Gemara talks about the idea of the two guys in the boat and the one guy starts kind of drilling a hole under his seat, saying, this is my side of the boat, what's the big deal? And the other guy is sitting there saying, well, wait a second, this may be your side of the boat, but if you make us sink, we're both going down. That's the way that I look at this. I look at this as we're all in this together. No different whether it be masks, whether it's the vaccination. For the first time, maybe in our common history that we can remember, we're in this together. And if everybody is in on the same page, we can sink or we can swim. And I very much hope that we're able to figure out how to swim.
I have
There are lots and lots of people who choose not to vaccinate their children, as I'm sure you all know. My feeling is if the parents choose not to vaccinate their child, that's their right. But I would then say you can't send him to school with my child. You have a right to not vaccinate your kid, but you don't have a right to contaminate my kid and all the other kids in school. And I don't know how that works out, but that would be that's how I would solve that problem.
I think Jewish law precedes the FDA greatly, with really carefully analyzing what Rabbi Ari mentioned earlier, the concept of chazaka. There's got to be a firm ground that you're standing on whenever you're just throwing something out. So we really have to know what we're dealing with. And I think one of the nice things, one of the hidden blessings that we have in our current situation is the uncertainty. It makes us a little more humble to realize that we just don't know. And when I hear from Dr. Zweiback or other good doctors that I've talked over the last few months, and they say, well, we just don't know. There's a comforting feeling about that. And it allows us to really pay attention to ourselves. It allows us to create a little bit more faith in God. And it also allows us to work together. It's not you and me. It's not Republican versus Democrat. It's not economy versus health. It's really us as people, as a united factor and all created by God. And we all have to be united more than ever. And I think that that's really what's happening. And the uncertainty is going to be with us for a while. And perhaps that is the new normal.
I have a few comments to make. First of all, there's an idea that when we as a nation are not actively doing mitzvot, we're not really able to do so many mitzvot for each other, what happens is I become very opinionated, and I think that's what's happening now a lot as well. Everybody is speaking in very absolute terms, or they're posting things of other people speaking in absolute terms, which I think is a tragedy. I think what happens is what I become is my opinion, whereas what I'm doing for you, what I'm doing for other, what I'm doing for God, or what I'm doing for myself, and I become my opinion. And I think what happens is it becomes very strong. And everybody has a strong opinion. Most people I see on social media don't really have half statements. They make full statements about what they believe in, which is something I think is a challenge. And I think that's something to be aware of. I think also we have to understand that as Jews, we believe in God. We believe God has messengers. We believe in medicine. But medicine is also limited. And yeah, it's true. A doctor would call me up on a certain day and say, you should be doing this and this and this. 2 days later, that same doctor is saying the exact opposite, which is fine. I probably knew that all along. But I think that's the only thing we do have. The only thing we do have is somewhat not to be fully reliant on the doctor. We understand that the doctor is an emissary and really an agent for God. And therefore, they're going to be limited, but it's still more than I know. The ones making a decision at the end of the day have to be people who are looking at the big picture. And the doctors are able to influence how we look at that big picture in more than anybody else. And I think that's a system that we need to rely on, question. We're not supposed to accept everything blindly, but the danger is when I think a small, a little knowledge is a very dangerous thing. And I can get a sound bite from somebody online that says this and this and this, and all of a sudden I'm creating my position based on a sound bite, based on a very little information. And I think, as Rabbi Katzman said, that's one of the big takeaways. You know, there's a song from Hanan Ben Ari. I would suggest everybody Google it after. It's an Israeli singer. I don't even know if he's secular or religious, but it was written by somebody, Rabbi Leor Engelman, who basically said, please God, don't let all the lessons of today ever go away. Like, don't let everything go back to normal. Don't let, when God willing, the vaccine is accessible for everybody and this virus is behind us, let's not go back to where we were. Let's understand humility. Let's understand unity. Let's understand mitzvot. Let's understand that essentially there's really one being that can really send the complete recovery. And I think it's a very powerful song, and I'm sure there's lyrics in English. Hanan Ben Ari. Google it afterwards.
I'd like to follow on what Rabbi Ari just said, and Marty, your question, I think about kind of the distrust in the society and the soundbite based culture. All of this, to my mind, points to what is the single biggest problem in American society right now, even perhaps bigger than the virus, and that is the disease of deep division that plagues our society. I mean, it's the question of kind of trusting a vaccine emerges, and then those people will distrust or they'll trust, and it's all processed through this political lens. It's obscene. Though, the way the country has gone. I have this kind of dark, cynical, as a former political operative, kind of scenario in my mind that I think I see kind of playing out, or at least if it doesn't play out this way, I think it kind of captures where we are right now, and that is that I see a vaccine emerges in the fall prior to the election, and promoted by the government. Everybody who likes Trump takes the vaccine. Everybody who hates Trump refuses to take the vaccine, and everybody who loves Trump, is vaccinated with this thing. They go to the polls. They're loving it. They're voting. Everybody who hates Trump, not vaccinated, too scared to go to the polls because they don't trust Trump, and it all plays out that way. I mean, it's absurd. And it's disgusting where this society has gone, that we process everything through what we think about Donald Trump. So much so that that all of the information that we get about the virus or the medication or the cases, I mean, you name it, everything is filtered through that lens. That is a terrible problem in our society that we have to overcome. And what Rabbi Katzman was talking about kind of seeking unity, and we're all in this together, is like, frankly, I hate to be unhopeful, but I don't know how that emerges, that kind of culture emerges, as long as we have our heels so deeply dug in, and we are divided against ourselves over politics. That is the greatest crisis to me in American society today. We have to find a way to overcome it.
Mm-hmm. I want to go on to a question that I'm struggling with, and I suspect a lot of other people are too. And that is that as we look at the list of people who are on this meeting, and not everybody, so I'm not talking about everyone, but a number of the attendees tonight are older adults or people who might have other what are I guess charitably called comorbidities, not necessarily a pleasant word, but it's the case. People want to keep themselves and their loved ones safe, but they also feel a compulsion, a draw to get out of the house and do something. Might be to donate blood, to serve meals, to distribute critical items to people who are in economic distress. How do we balance this tug of war that many of us feel between self-preservation and what we think are our obligations to society?
It's actually a very good point, Marty. Actually, I just got off the phone with my mother, who is a little older than me, and it falls into that category and has gone through as many elderly people that are on this call. And it's a very difficult call to be made. You know, she doesn't want to be isolated for too long, but yet we're trying to keep her isolated. So yes, there is a a difficult balance over there how we do it. However, during the cholera earlier pandemics, there have been tshuvot that were written concerning people visiting other people, and the rulings generally were not to do that at any risk. However, physicians or people that are in a position of healing not only are allowed to, but become obligated. If there's a way that you can, obviously in a safe way, where you can't just say, I'd rather be safe and stay out of this situation because you have a unique God-gifted position to be able to overcome. But today, a lot of what you're talking about in terms of helping, we can do via telephone, via Zoom. We can use the postal service. There's many ways that each and every one of us that are on the call, not only for ourselves, but really become a little bit more outwardly focused. I know the Blumkin home here is having the window visits, which is very welcoming, and I'd ask everyone here who hasn't done it yet, please call the Blumkin home and make reserve a spot. And the more we can do that, the more we can send gifts, the more we can share that love. I think that's really where it's going to start, and hopefully will answer Rabbi Stoller's concern as well, because love is more powerful than hate. And if hate has the ability, if evil has the ability to grow so fast, love has a greater ability, and I'm confident that it's going to happen.
Rabbi Stoller was concerned about how do we change. My only thought would be that there will be an opportunity to change on November the 3rd. And we'll have to, and our nation will have to decide just how badly they need to change.
So I want to comment on that as well. Dr. Zweiback, I agree with that. And I also think that, and anybody who knows me thinks that, I think that's also a scenario that there can be change, but I think we're missing the point. We can actually affect change every single day. I think a lot of times, we just finished Tisha B'Av, we finished the 9th of Av, and we talk about Ahavat Chinam, we talk about loving other. A lot of times there's a lot of things that make us feel good. And when I talk about loving other, I'm talking about somebody that may be naturally distant from me. I think the change is within me. I think that we can always talk about political leaderships and talk about what this person's doing wrong, what that person's doing wrong, what this rabbi is doing wrong, etc. But I think we're missing the point. We have to change ourselves, and we have to learn the lessons. So it's true, perhaps November 3rd, everyone's going to think that things are going to change for the better or for the worse, whatever. I disagree with that statement. I think what we have to do is make the most out of Monday, today. And we have to see everybody else in our lives in a positive light. And we have to see opportunity to change and opportunities to be deeper. So to Rabbi Stoller's point, I'd like to quote G.I. Joe, knowing is half the battle. If I know that there's an issue, that is half the battle. and I can make the change, and I have to view it differently, and I have to continue to learn at venues like these and others to be able to say, look at everybody. Everybody is really acting with their eyes closed. They're not seeing a bigger picture. I have to be able to see the bigger picture. I have to stop enforcing this divide or promoting this divide. I can change the world around me. And for sure today, when so many of us are connected across the world because of Zoom and because of all these programs, I can affect that change. And I have to be very careful if I'm creating something negative. And this is where even social media comes in. I have to be very careful in what I post, because that Lashon Hara, that could be so destructive to the world. And I may think I have good intentions in doing so, but it may completely be based on a subjectivity. So I do think, and I'm very positive that of course change will come. It may not look like the thing that we think is going to bring about the change, but I have to change, and I have to constantly grow, and I have to constantly work on myself to make sure that everybody in my life, I'm seeing in a positive way. And then God willing, they'll see me in a positive way as well. And I think that is a very, very powerful lesson. Perhaps one of the big lessons that we can learn from what's happening around us. I didn't address.
Yeah, I love that, Rabbi Ari. I think I amen to that. I mean, I second it fully. We have, there is, apropos the social media and everything, there is so much shaming of people. There is so much contempt. There is so much absolutism to the point that we all know this. People are choosing to end friendships and to sever ties with family members, to create more chasms, more darkness in this world, rather than trying to heal it. And all over this obscene political divide, it's consuming us. I mean, it makes me think that the Torah's greatest concern, one of the Torah, I think, I mean, is you shall have no other gods besides me. Like the essence of the Torah is combating idolatry. My feeling is that our society is consumed by idolatry right now. The kind of power that we surrender from ourselves and project onto others, onto a political figure or onto anything else, the power that we give those individuals like that over our own lives voluntarily, that's modern idolatry. We've got to take it back. We've got to do exactly what Rabbi Ari said, take responsibility for ourselves, stop blaming everybody else, stop shaming everybody else, start trying to build a world from love rather than from hate and contempt. If we don't do that, I mean, the virus is, we're destroying ourselves. We don't even need a virus to do it. I'm going to choose to associate myself with Rabbi Ari's optimism, because I think his prescription is exactly right.
These are all great comments, but I would like to get back a little bit to the original question, which was really meant to be a sort of non-political, practical question, and that is that given the dilemma that many of us face between keeping ourselves safe and cooped up versus being out and doing things that we think we ought to be doing, what do we do? What wisdom is there in sort of assessing assessing those relative risks or situations, which really doesn't enter into politics so much, but really is a matter of how we behave as individuals.
I just want to jump in. I noticed that one of the areas where everybody became professionals or knowledgeable in halakha was the halakha of pikuach nefesh. The pikuach nefesh, saving a person's life, doche Shabbos, it pushes aside all the observances of Shabbos, and you got to do whatever you got to do in order to save a life. And on that ticket, many people are writing, okay, Shabbos is out the window. Okay, now I can go golfing peacefully and without any conscience and so on. So we use that in order to push away and say, well, Shabbos is not really that important. But the opposite is true. When we say pikuach nefesh docha, that pikuach nefesh, saving of a life, pushes aside the observances of Shabbos, is telling you that pikuach nefesh is very, very important. So in order to do that, if you ran out of coffee, that doesn't apply. You'll live without coffee. But we tend to stretch it a little further. So therefore, but that exact thinking has to be evaluated when you are talking about opening up, when you are talking about the economy, when you're talking about the social pressures that people are facing, and all of those arguments that are going back and forth about whether we should open or we shouldn't open. Are we comfortable? Are we not comfortable? Are we digging ourselves into a hole that we'll never get out of? I mean, all of these arguments really, obviously, we have to remove the political and all of the personal and business and side interests, but we just have to be focused. Pikuach nefesh docha means they have to be focused on your responsibility, your obligation. So you have an obligation to God. We talked, earlier was the conversation about performing mitzvot, performing good deeds. That's the overall part of the overall obligation. And in that package of mitzvot, there are things that's between man and God, between man to man, between man and himself, and all these different connections and communications have to be taken into consideration when we're making a call like that. And we can't just be, since we're in the economic area, this is what our interest is, and since we're in medical, we're taking. But again, this is something that we have to work together in coming to an honest, objective question as to what's better for all of us.
I want to ask another question, and this relates to a question that I've been thinking about, but also was also in the chat room. A distressingly large number of people are really prolonging the severity of this pandemic by ignoring medical advice and rebelling against low-tech but well-proven public health measures like wearing masks and maintaining distance, not going to bars, not going to large gatherings. And there was a comment actually about 2,000 people at a party in Oshkosh, Wisconsin. I know Oshkosh, Wisconsin. They're a client of mine. I can't imagine that big a party in Oshkosh, but perhaps, how do you convince people from an ethical and even religious, even if they're not Jewish, perspective of their responsibilities to themselves and to everyone else who they encounter? How do we make that point? It's a very frustrating thing.
I mean, if I can just chime in here, I think this is something that, I've thought about ad nauseum and talk about ad nauseum probably also, so I apologize. Again, I think we have to change ourselves, and I think we have to work on ourselves. I think we have to clarify for ourselves why that bothers us so much. Meaning, say it a little differently. For us, as the Jewish people, our primary focus is responsibility. We don't focus on rights. We focus on responsibilities. That's our primary focus. That system works. That system is eternal, because I don't come up with my right before I understand what my responsibility is. If that message is clear for us, then I think we have to radiate that outwards. I think that's what it means to be a light. What it means to be a light is, number one, whether I agree with it or not, whether I know the science of it or not, whether I can understand, or whether, as Rabbi Katzman said before, I have the antibodies or not, it doesn't make a difference. I'm part of something larger, and I'm responsible for other. Mitzvot is how we look at the world, it's how we live the world, and that's responsibility driven. However, in America, it's right driven. and I have a right to do something, I have a right to protect myself, etc. That's a big clash when my right goes up against your right. I don't know the answer to that. I know the answer for us. For us, we're responsibility based. And if that means, and that's an eternal system, because that means we're always going to look out for each other as well. But when it's rights based, it gets a little bit more complicated. So the answer is teach Torah. Short answer.
Other thoughts?
Yeah, I want to second that. Teach Torah.
Teach Torah.
Yeah.
But
Keep going.
no, I think the point again has to be reiterated. You know, if we think that you can't do in August what you can do in November, again, we're missing the point. Because at the end of the day, at the beginning, it's me. And if one scientist in China can cause havoc in the entire world, one mitzvah, again, I mean, you know, Rabbi Ari is talking about ad nauseum. I can second that too. But really, it's the mitzvahs, it's the kind acts that we perform towards our neighbors. It's the positive vibes that we're spreading in social media. All of those things have incredible impact on the global scene, and I would venture to say even more than Washington has.
Stephen, you're unmuted. And
You know, from my understanding of American law, and there are, you know, for the 100 and some odd people on here, that somebody else can correct me, my rights don't extend only to a certain degree. I can't walk. My First Amendment rights don't allow me to walk into a building and say that it's burning down, or to walk into the movie theater and say that there's a fire, God forbid, hurting other people. So don't tell me this is a rights that may be at its core, but the founders also, and dare I say, our rabbis of the founding fathers and those who came after, put in provisions to make sure for the fact that you weren't trampling literally on other people's rights. So that to me is nonsense. Judaism, I understand the fact it's all about obligation and responsibility. I also believe that the 613 mitzvot are a really good start. I also know that the rabbis derived some of those 613 from things that I believe personally, maybe it's me being a conservative rabbi, maybe it's me being a heretic, believe in the fact that they were pretty thin. And so I look at the idea of wearing a mask, and I look at the wear of getting, you know, immunized, and I look at all of those things, and I go back and I say to myself, do it. I don't want to talk about it. I don't care about making people feel bad about it. So we can talk about the social media all we want. We can talk about the nonsense. Like, I don't understand. When people don't wear masks, they put me and my family at risk. Done. Thank you very much. Let's stop with the BS of what this is. Talk about what it is. If they're not doing that and they're not being safe, they could be asymptomatic, right? We have institutions in the Jewish community that when things happened and there were people that were found to be asymptomatic but were positive, we cleaned a pool. Pools don't have COVID. People have COVID. Right? We need to be thinking about the bigger picture. This isn't about shaming anybody. This is about being smart. Right? I would never in a million years want to make anybody feel less than. And I am not a medical professional, so I'm going off of what those people tell me. But when I look at the numbers and I say to myself, and you look at Douglas County specifically right now, and you see the numbers and the upticks of where they're going, and the fact that our leadership, and under the concept of Dina Malchuta Dina, that we live under a society where in Jewish law we follow the law of the land. What do you do when the people who are your leaders, who are actually the leaders of the land, aren't doing right? That they're worried about the law more than they're worried about people's health. The Talmud, with all due respect, maybe this is a disagreement between all of us. I look at the Talmud and I say to myself, this is a political document. There was politics involved. The only good news about it was that the minority and the majority opinion was always written down, which I have deep respect and profound respect for. But it was a political document. And it's okay for someone to tell another person, you know something, you're putting my family at risk by not doing X, Y, and Z. If we don't have the guts to do it, well, then that's so be it. But don't tell me that that's because of the fact that we don't want to shame people. That to me is, that's nonsense.
I would add, I think the point, Rabbi Ari's point about the distinction between rights and responsibilities within the Jewish framework of things and the American framework. In this case, I think it all dovetails together actually, because in Judaism we have the idea of everybody's responsible for one another. We walk through the earth with the sense of my role is responsibility toward the other. In American rights-based law and political philosophy, there's the kind of the key principle of classical liberal political philosophy is that my freedom ends where your freedom begins. So so even rights-based theory is not absolute, like Rabbi Abraham said. I agree with that, and I think both legal doctrines argue for taking the kinds of precautions like wearing a mask and keeping distance and whatnot, in both out of responsibility and from a position of rights and protecting the rights of others. And ironically, perhaps for those who don't want to do those things, but and want to go out, taking those simple precautions actually enables people to go out. And that's the thing that to me I find a little bit baffling. If we want to say to your earlier question, Marty, if it's about trying to navigate this balance between staying in and going out and living our lives, if people would just wear the masks and keep their appropriate distance when they're out in public, then they can go out. I think you don't have to stay in and seclude yourself from life. You can actually go out and do things as long as you take reasonable, responsible precautions. One of the I spoke with a physician in our area who's an expert in the pandemics, and he explained to me very clearly and simply that these measures that we are using, wearing masks and keeping 6 feet apart from each other, these precautions are designed on the assumption that everybody you interact with is positive for COVID. We use these protocols precisely because they're designed to protect against interaction with someone who's positive. So it seems to me from all sides of the whatever, the coin or the various perspectives, it just makes sense to wear the mask and to keep your proper distance, because then everybody's rights are protected. Everybody's acting responsibility toward one another, and we don't have to completely lock ourselves down from life. We can actually go out and engage in a responsible way.
We're experiencing, and some of this conversation is leading in that direction, this tug of war between two positions that appear to be oppositional, polar opposites, that is placing the highest priority on individual physical health and on a view that psychological and economic health of the general community is the highest priority, and that argument, that position argues toward opening up. A lot of us think that the latter is dependent upon the former, but from a medical and halachic viewpoint, how do you balance the likelihood of psychological and economic health of the public against the likelihood of physical illness from the virus? Where does that, is there a dichotomy, or are public health measures really, as many of you have said, the way of moderating that and steering a middle ground?
All right, I guess I'll jump in. I think I have an overarching answer to all these questions, which is, I don't think it's black and white. I don't think it's either, that statement about opening up versus keeping it shut. I don't think that has to be so extreme. In other words, of course, these are issues, and psychological welfare is welfare, is physical welfare as well, and those are exactly the same. And it's true, it's a big concern. But I still think it's important to understand that it's not black and white. When we started davening at shul again, so we started having minions, and I thought that was a great opportunity for us to understand what the point of a shul is, right? And what's the point of a synagogue in the first place? So it's true, we don't do kiddush at our shul. We don't daven inside, we don't have minyan inside for the most part. Why? Because we could do it outside. And I think it's an important thing to distinguish, to understand. We could do things. It's not black and white. It's not open versus closed. It's, you know what? There are people here that don't feel comfortable going to a mass event with a lot of people, but they'll go to a grocery store and they'll feel comfortable about something that they think is necessary for them. Someone mentioned in the beginning of this talk about the priority given to young people. I think that's not such a halachic Jewish concept. I think it's important for us to realize that in Judaism, life, I actually saw this tshuva from Rabbi Auerbach recently, that he says even a person was at the end, what's called a goses, a person is at the end of life when they don't really have any functionality. They said we can't take matters into our own hands, we can't end that person's life, because who are we to decide what life is? If a person's alive, even if they're not functioning at a certain level, we can't take matters in their own hands. And I think that's an important distinction for us to make. Life is life, and human life and physical life is incredibly important. I just don't think that it has to be so black and white. I still think, yeah, emotional health does play a role. Does that mean that we go from A to Z? Absolutely not. I think we have to distinguish what's safe with medical backing, what is safe, what can we do, what should we do, and we cannot be captivated by fear. We have to be captivated by aware. We have to be aware. We have to be aware what's considered dangerous. We have to be aware of our surroundings. And if we're captivated by fear, I think we're missing a boat here also. It cannot be about fear. It has to be about aware. And I think, again, that's part. If I'm captivated by fear, then I'm losing this battle, the psychological as well, and probably even the physical. It has to be about being aware. It has to be knowledge-based, and it has to be scientific-based as opposed to fear-based. And I think, and so that was a long answer to really a short answer, which was, I think it's not black and white. I think, of course, it's a concern. Psychological is for sure it's a concern. The policymakers have to take both into consideration. I think they're both equally important.
Let me give you a practical example that happens every single day. Organ donation. You have a kidney to give. You have a 85-year-old nuclear physicist who needs a kidney, and you have a 12-year-old fifth grader or sixth grader that needs a kidney. The decision is not easy, but the decision has to be made. Somebody has to step up and say, assuming they both are good candidates, somebody has to decide who gets that kidney. And this comes up every day.
Right.
And I'm not sure the answer, but it's very complex.
Mm-hmm.
And people's minds change all the time.
How complex it is, and as much as it's a global situation, I think each and every individual has to look at his own position. And I think as Jews, we have to look into the Torah. We have to look from that position. We also have to talk to our physicians, our medical advisors, and come to that balance. I mean, obviously we're all doing the mask and we're all doing the standard stuff, but yet there are people who are still afraid to leave their houses. They're perhaps taking it a little too far. So that actual balance is really the question. But at the end of the day, are we all doing our absolute best, or are we focusing too much? Again, I think we were maybe a little bit too, downplaying the political too much, Of course, it's important for us to be involved in the political, but what I can do as an individual is a lot more important than what I think the politician is going to do for me. And I think if we all look at it in our own situation, I'll just close with the phrase that Reb Zusha used to say, one of the early Hasidim. He would say that after 120, when he's up in the supernal day of judgment, he thinks, what's going to be when they ask him why you weren't like Abraham? Well, he says, I wasn't Abraham. Why didn't you behave as good as Moses? He says, but that's all no problem. But when they can finally ask me, why weren't you what Zusha could have been, that's when I'm going to be stuck.
The problem, yeah.
So I think if we all make sure that we do the absolute best that we can do under our with ourselves and our immediate circle, I think we're going to do great. And everybody should be well. And as a Kohen, I'm blessing all with good health.
As we near a close, let me just remind everybody about Maimonides, who was a spiritual leader as well as a physician. And he said, save a life, respect our elders, and educate our children. And I mean, those are three very broad principles that I think can help all of us.
Good. Well, I think we're at I think we're at 8 o'clock. I did want to ask one final question, and that is that obviously reopening facilities is a major controversy in the society, and these facilities include schools and synagogues. What level of risk of infection can we tolerate, if any, as a baseline before we really reopen our institutions, before we're back in the seats? Is it what is that threshold that we're going to feel safe in?
I'm going to go back.
Brian, what do you think?
If no one else is jumping in, I think there's no way anything should be done loosely, so to speak, without a competent professional medical authority. Like, for example, in our situation, we also started at a very low degree our services. Nobody is kissing the Torah, you know what I'm saying? We have all those additional precautions, which would have been considered very un-Jewish and definitely un-Hasidic, but this is what you got to do because it's there are risks involved. So I think that in the terms of halacha is suffix, which means a doubt. Even a suffix, a double doubt has to be. You always have to err, to the stringent and not do it.
Well, I think it's, this is the $60,000 question, of course, but I don't think that there's any one answer. And that's already illustrated by, just the diversity in what we're doing here amongst the various institutions represented on this panel. I mean, Beth Israel's having Minyanim in person, and it sounds like Rabbi Katzman is having some various things going on in person. At Temple Israel, we're not. I'm not sure about Bethel, but anyway, we're all kind of handling it a little bit differently, which points to the fact that there is no one line. It's all about it's very subjective, but I think to my mind the important thing is that this can't be a situation of zero risk. There's nothing in the world that's zero risk. So I don't think we should be aiming for zero risk or setting that as a standard, because if that were the case, then we should really never open our synagogues ever, because there's all kinds of risks associated with being alive in the world. So I think zero risk is not realistic, but I think we need to be and therefore it's not helpful to my mind to have this conversation in absolutist terms. Like, sometimes people say, like, well, if you open the building, you're going to kill people. I mean, what does that get us? Like, that's not helpful at all. it's an unrealistic standard to aspire to zero risk. We need to be thinking about instead, how can we, like we were saying before, how can we act, responsibly, taking into account the matrix of risk and the various things that are being lost in the situation, the things that are being gained or stand to be gained, and each community has to make decisions for itself. They are already doing that, and so I would encourage, just kind of apropos the conversation we were having earlier about just the nature of discourse. If we can find a way to shift our discourse away from absolutism and away from, soundbite conversation and contemptuous conversation, and really try to come together around reasonable conversation about the risks and the benefits involved in our decision making, everybody will be a lot better off.
So I find myself agreeing with Rabbi Stoller a lot, which is very unrabbinic. So I agree 1,000% with what was just said. I love what you said. I think, again, the danger is when we speak in absolute terms, there's an undertone of politics. And someone made a comment, I think two people made a comment about the Talmud being, I'm not even sure what that means, a politicized book, or I'm not sure what that means. For me, it's a spiritual analytical book in which I try to seek out objectivity and truth. And with every decision that we make, anybody has to become so self-aware and work on themselves and pray and look in the mirror and to speak from a place of humility and to make decisions from a place of humility. As a leader, I have to make a decision from a place of humility, not from a place of self. As an individual, we all have to be leaders. And when I'm leading my own personal life or my family life or my friends and people are seeing what I'm doing, if I have an agenda, if I have perhaps a political agenda, and may not even know that I have that, but if that's what I'm pursuing, then I'm going to make mistakes. And then I'm going to actually head somewhere I perhaps should not head. But if 95% of the work that I do is self-reflection, then the 5% of decisions that I make are going to come from a purer place. And I think that's important for a rabbi. I think it's important for an individual. It's as important for a political leader, maybe more challenging. There was a political leader who came to meet with me a while back, and I said, stop trying to meet the needs of all the people in terms of their viewpoints. Seek out what's true. And he said, yeah, well, then I wouldn't make it as a political leader. I said, well, okay, it's true. But I think we're not political leaders. And again, I think the Talmud is not that at all. I think the Talmud and these works are about me spiritually perfecting myself and the decisions that I make. And there is a background, and I hear it, and I sense it when I see what people are posting about institutions, about synagogues, a political background. And it's to Rabbi Stoller's point before. If I'm not aware that I'm actually projecting that as well, I'm a part of the problem. And I have to be really careful how I speak about institutions. I have to be less careful about how I speak about myself. I'm done.
Well, I think we're at pretty much the end of our time. It's been an honor to be with all of you tonight, with our great panel, and with 110 or 120 of all of you in the community. I hope you found this to be a helpful and stimulating session, and we look forward to the other sessions of this of this series of forums. So with that, I'll turn it back to Jenny, who's going to wrap up.
Thank you so much, Marty, and thank you to all the clergy and community members who participated in this panel. We do have our next session. It will focus on the same topic of COVID-19, but hearing an update from local medical experts, so from a very different perspective. So that is going to be Thursday, August 20th. And let's see if I can actually do what I wanted to do really quickly. So those are some of the names, lots of names. I'm not going to read them all. Look very quickly. This is the basic panel, and we'll be sending that out. So I just wanted to make sure that I thanked all our participants, and we have one additional date secured for another panel that is perspectives on Israel. There's a feeling that with all the talk of COVID and racial unrest and the upcoming elections, there are a lot of things in the news that are not talking about Israel. So we're going to have a panel that kind of provides multiple perspectives on Israel, and that is going to be Wednesday, August 26th. There will be one more panel probably in September, so keep your eyes peeled, and thank you so much for joining us. We appreciate everyone coming on.
And everybody take care of yourselves and be well.
Yes, please stay healthy.
Thank
Thank
you.
you.
Thank you.
Thank you very much.
Thank you.
Thank you, everybody.
Thank you, everybody, for all your very wise
Thank you.
I appreciate everybody who participated tonight. Thank you very much.
Thanks, everyone.
Shelley Fox.